Good day, everyone. My name is Dumaran from BSN 2, and today I'm going to perform the Leopold's maneuver. So first and foremost, before we start with the said procedure, we're going to identify what is Leopold's maneuver. So Leopold's maneuver is performed in pregnancy after the uterus becomes large enough to allow differentiation of fetal parts by palpation. So this maneuver comprises of four steps, which is the fundal grip, the umbilical grip, the pollex grip, and the pelvic grip. So in this maneuver, we can identify which is in the fundus of our client, either the head or the bridge. Secondly, we can know where is the fetal back lies. Is it in the left side or is it in the right side? Next one is we are going to identify the presenting parts as well as the cephalic prominence. So basically that is the background of this performance. Um, we are we need to also know that in performing the Leopold's maneuver, it should be done 36 weeks after gestation. So now we are going to solve if the patient is good to go in terms of this said maneuver. So after that, we already solved, and in this case, we um, we get that the patient is already okay for the said maneuver. We are now going to start the said procedure. But before that, before we start the said procedure, we are going to wash our hands, provide privacy, and after we provided privacy, we are now going to check if our patient is correct, and we need to identify our patient, and then we are going to explain the said procedure for our patient. Wash our hands. So, so if you have gloves, you can also apply gloves if necessary. Provide privacy to for the safety and of course the privacy of our patient or our client. So the next step that we are going to do is we are going to identify our client. So we have our ma'am, pwede kong mangkot sa imong apelyido.
Oh,
Ang sa imong apelyido, ma'am?
Miss Olaya.
Okay, so Mrs. Ulaya, kabalo na ba ka kabalo na ba ka anong ano to perform karon?
Oh,
So, i-explain na nako ang procedure sa imo ma'am ha. Ang atong buhaton karon is atong impulse maneuver. So basically kani nga maneuver mabalan nako kung unsa ang naa sa imong fundus, kung asa ang likod sa imong baby, asa presenting part sa imong baby, as well as ang cephalic prominence. So ang nitabuan ni ma'am kay is palpate na ko ang imong tiyan, ang sides sa imong tiyan o ang outside part sa imong tiyan para mabalaan nato ang ato ang kung asa tong mga presenting parts or ang fetal parts. Okay lang ba to siya, ma'am?
oh,
Okay. So ako akong mag-touch jud by palpation, ma'am, ang imong tiyan, no, ma'am, no? Okay lang na siya, ma'am.
oh,
So after we already explained the said procedure to our client, we are now going to start with the said procedure. So the first procedure that we are going to do is the fundal grip. So in this case, what we are going to do is we are going to be facing the head of our client as well as we are going and the three tips, both of our arms, will be the one palpating the fundus of our client. So ma'am, sikwaon sa nako ang blanket nun ha. Suppose that our patient agrees, we are going to um, get the blanket and we will provide a small pillow underneath our client for support. So the next step that we are going to do is we are now going to lift the patient's t-shirt if they have any, and by that we are now going to use the tips of our fingers and both arms, and now we are going to palpate the fundus of our client, which is located here. So we are now going to have a triangular manner or shape. upon palpating. So if you're going to focus on our client, we are now going to palpate our client. So basically, this answers the question where is what is in the fundus of our client, either the head or bridge. So basically, after after we are going to palpate, if we can identify if the head is in the fundus when it is it will feel hard, smooth, globular, mobile, and valutable. Whilst if we can feel soft, irregular, round, and immobile, it is the bridge. So we are now going to do the said maneuver. We're going to palpate the fundus of our client. So upon palpation, take bear in mind what can you feel upon palpation and identify which is found in the fundus. So the next step that we are going to do is the umbilical grip. So basically in the umbilical grip, what we can find is the fetal back. And it answers the question what and it answers the question where is the back of the baby. So basically what we're going to do is we are going to still face the head of our client, and we are now going to palpate the each side of the abdomen, and basically we are going to place place our hands both sides of our either side of the abdomen, and upon doing that, in this case, if you're going to start in the right side, this left arm of yours should be stationary up whilst palpating in the right side, and vice versa. If you're going to start in the left side, this right hand should be stationary. So the we can identify the back because we can feel firm, smooth, as well. We can feel firm, smooth, convex, and resistant. So that is the no, that is the indication that you already identify which where is the back. So we are now going to start. We're going to start in the right side. So this should be stationary. Okay, and vice versa. We're going to put this. It should be stationary and palpate. So identify where you can feel the said indication. So the next step that we are going to the next grip that we are going to perform, or the third maneuver, is called the Pollick's grip. So in this case, we are going to answer the question if where is the presenting part. So basically, we can find the presenting part in this case, and as well as um, yes. So basically, in this, what we are going to do is we are going to still face the head of the client, and we are going to place the tips of our fingers, the tips of our first three fingers of each hand, either side of the patient's abdomen, just above the symphysis, so which is here. So let's assume that this is the symphysis, or the just above the symphysis, so it is here. So in that case, we are going to talk to the client to upon we can say that they should exhale, and while they in we after that we are going to insert, or we are going to we're going to push our fingers slowly and deeply, and we are going to identify. So the head will feel the head, and if we can in this procedure, or in this maneuver, we can feel the head. Uh, the head, we can feel hard, smooth, and mobile. Then we can know that if it is hard, smooth, and mobile, it is engaged. Whilst if it is immobile, it is not engaged. So whilst if it is the bridge, what we can feel is that it is soft and irregular. So, ma'am, pwede ka mo exhale, ma'am? Okay. So, keep in mind the indications as what, if you're doing this, keep in mind the indication, and you need to know what is, or what can you find, or what can you feel upon palpation. So the next, or the last, maneuver that we're going to perform is also known as the pelvic grip. So pelvic grip, we can show, we are going to be facing the feet of the client. So basically, the fourth maneuver is called the pelvic grip. So it answers the question, where is the cephalic prominence? And in this case, we are going to find the cephalic prominence. So what we are going to do is we are going to face the feet of the client. So after which, we are now going to be gently, um let's focus the client. So what we are going to do is we are going to gently move our fingers down to the sides of the abdomen, forward to the pelvis, until until our fingers of one hand encounter the bony prominence. So if we can encounter bony prominence, what we call that is what we call the cephalic prominence. So what we're going to do is we're going to place here our hand both, and we are going to be doing this in a downside, or in the outward manner, or pababa. So what we are going to do is we are going to, in this maneuver, it is it is a it is a maneuver that supplies and um, it supplies and give importance to the second maneuver. So what we're going to do is we are going to palpate the side of the abdomen until the until here. So we're not going to perform. So note for the bony prominence. So when you can feel any prominence, that is the cephalic prominence. So basically, um, so basically, that is the Leopold's maneuver. The first maneuver is called the fundal grip. The second is the umbilical grip. The third is the pollic grip, and the fourth one is the pelvic grip. So after we already have done the said procedure, we are now going to thank the client for their cooperation for the smooth sailing of our procedure. So you need to also keep in mind that upon doing the said procedure, you need to instruct the client to take the restroom if she wants, in order to not have any discomfort during the said procedure. So, we are going to thank our client for the cooperation. So, ma'am, salamat. Human na to ang Lupus maneuver, o human na itong procedure. Salamat kayo sa imuhang pag-cooperate, kay nahimo na to ang procedure nga hand-eye o smooth sailing. So, salamat kayo, ma'am, ha. So, we are now going to make our patient comfortable. So, with that being said, we are now done with the said Lucas maneuver, and thank you for watching, and I hope you learned something today, and thank you.